Depression is a mental disorder that affects the brain. Over 25 million Americans suffer from it every year. There are more Americans that suffer from depression than they do cancer, heart disease, and AIDS. It affects people's moods, making them feel hopeless, sad, and they also have a great feeling that they do not belong. Many people with depression think a different way, feel a different way, and will even behave differently. There is a mild depression disorder and a much more serious depression, which is called major depressive disorder, or MDD. In this video, we will be discussing major depressive disorder and all that comes with it. If someone is to have MDD, it is much more serious and debilitating. It will last longer than mild depression and will affect someone's everyday life. Some of the symptoms that a person with major depressive disorder have are feelings of sadness and hopelessness, lack of motivation, sleeping too little or too much, restlessness, constant stress, fatigue, excessive or inappropriate feelings of guilt or worthlessness, multiple thoughts of death or suicide, and/or a suicide attempt. Depression is a neurologically diagnosed disease that occurs in the brain. The three main parts in the brain that are affected by depression are the hippocampus, the prefrontal cortex, and the amygdala. The hippocampus stores the memories and regulates the production of a hormone called cortisol. Cortisol is released during times of stress, which includes during times of depression. So, for a person who is depressed, a lot of cortisol hormone is released. In a healthy brain, there are neurons that are produced that are called dentate gyrus. These cells are located in the hippocampus. However, in a person's brain with depression, these neurons cannot produce as quickly or in as large amounts because of the constant presence of this cortisol. This excessive amount of cortisol in the brain also leads to the prefrontal cortex to shrink. This portion of the brain is responsible in regulating emotions, making decisions, and forming memories. The amygdala is the part of the brain that facilitates pleasure and fear. In the brain of a person who is depressed, the amygdala becomes enlarged and much more active than that of a person who is not depressed. The amygdala can result in restless sleep and disturbances in everyday patterns. People who are clinically depressed lack serotonin, which is the feel-good feeling chemical in a person's brain. Depression can lead to negative thoughts, which then can lead to harsh and traumatic actions. Suicide has risen to the second leading cause of death among young people. Up to 50% of those who are clinically depressed die by suicide. If one includes alcoholics who are depressed, the figure rises to 75%. Many people who are depressed see death as their only way out, not realizing how permanent their actions are going to be and how many people they're going to affect by their action. If a person is depressed, there are treatments that can be performed to try and tackle the disease. Between 80 to 90% of people who are depressed respond positively to treatment, and almost all patients gain some relief from their symptoms. There are many medications that can be taken to help balance the chemicals within the brain. One of the most commonly used are selective serotonin uptake inhibitors. This prescription will help change the imbalance of the serotonin levels in the brain. These medications include Prozac, Paxil, and Celexa. Another way to help treat depression other than medications is to go under a medical procedure. There is electroconvulsive therapy or transcranial magnetic stimulation, which both involve the passing of electrical currents in the brain that help communicate between brain cells, and they also help the brain cells regulate. If the person with major depression disorder doesn't want to partake in medical procedures or take medication, there are other ways to help boost brain health. Maintaining a healthy lifestyle will help stimulate brain cells. Eating healthy foods, staying active, getting enough sleep, and avoiding alcohol and illegal drugs can help someone strengthen the brain cells as well. As an outsider to depression, there are many ways that you can still help. First, the best way to know what your friend or close relative is experiencing is to educate yourself and then help them learn what they need to know. Next, let the person who is depressed know that you are there for them. talk about their feelings, their stress, and possibly talk about seeking medical attention. Make sure to keep a positive attitude towards them at all times, letting them know that they are worthy and remind them of all their strengths. Overall, make sure to reach out to them in any way possible and be the ear for them to talk to. The thing about depression is that you don't choose it, it chooses you. And once it picks you, sometimes people have a hard time recovering to their usual mental state. Whether someone has depression or is an outsider to the disorder, the more people know the signs and the neurological diagnosis of depression, the better. Just like cancer and other diseases, the more people know about them, the more awareness is brought to the subject. With more awareness, the more funding and proper research can go towards finding a way to cure this disorder. Depression is a serious disorder that should not be taken lightly. We must shine a light on this subject to prevent others from having to live their life under a cloud of depression.